To get down to this question, you have to understand that there's two types of infertility treatment that we do. We do non-IVF infertility treatment, and we do IVF infertility treatment. With non-IVF infertility treatment, which is a very reasonable option for many people, and we do it, everything still happens inside the patient's body. The goal of non-IVF infertility treatment is to bring eggs and sperm together in a more efficient, effective way, and really, usually the only way to do that is to have more eggs meeting more sperm in an effective, efficient way in order to increase the patient's chance of pregnancy. So while this can be a very effective treatment in some situations, it's also a more dangerous treatment as far as making multiple pregnancies. And we kind of walk a tightrope when we do this kind of treatment for people. So, and actually, if you know people who have multiple pregnancy, who've had twins, triplets, or more from fertility treatments, a lot of those are resulting from non-IVF treatment and not IVF. Now, that being said, IVF treatment is where we actually, is in many situations, the first line treatment. We can recommend going straight to it in many situations, or in many situations people try non-IVF treatment first and then they go to IVF. If you use IVF, it's where we actually have the eggs and the sperm out of the body, and we're making embryos in a lab under the supervision of very highly trained laboratory personnel. It's a very delicate process. In that situation, we can tell which embryos in the laboratory dish have the best chance of making a healthy baby. And once you know which embryo has the best chance of making a healthy baby, you start only putting one embryo back in the uterus at a time. You don't have to walk that tightrope anymore.